Well, great, and I trust you can all see my slides and hear me. Thank you very much, Dr. Yasser. Remind me never to follow you in a meeting. What a wonderful, wonderful, important presentation. So I want to talk a little bit about some of the spiritual care. And in 20 minutes, can't do a whole lot. But I kind of want to do an overview of what is spiritual care in palliative care in humanitarian crisis. And then what is trauma-informed or what is disaster spiritual care? Because that's kind of a subset of this. And I agree 110% with my colleague a little bit about caring for the caregiver, the spiritual self-care, and so that we look at each one of these. Again, when we're talking about spiritual care, spirituality and religion, for some people, are related, but they are distinct constructs. And if we're going to provide palliative care, caring for the human spirit is essential, because both children and adults need to attribute meaning to illness, to death, to trauma, to disaster. Why is this happening? I love the work I do because I keep finding out that traditional Western, Eastern beliefs and theologies and approaches to health and healing and illness and death and dying and living weave together in very complex ways as people create meaning out of a life-threatening illness or a life-threatening situation. I want to stress, you do not have to know the answers. What we do need to be is actively present. And I get it, that talking about suffering and death and trauma can be countercultural in most settings. I add this when we're talking disaster and trauma. We want to provide comfort without re-traumatizing. And sometimes the best well-meaning, forcing clients to talk about an experience they don't want to talk about. So we have to highlight that we do not re-traumatize people, but we need to be in the presence of suffering, of lamentations, and not run away. We always talk in palliative care about this generalist specialist model. I believe every physician, nurse, social worker, counselor, chaplain, nutritionist, every healthcare worker needs a basic understanding of palliative care. We all need to know how to screen for physical pain, for psychosocial pain, for trauma, and spiritual distress. Then there's additional education that we get certified as a specialist in palliative care or certified as a specialist in trauma care. So today we just want to create kind of some more generalists. I know some of you are specialists here. What are we talking about with spiritual care? And this is this dynamic, it changes, intrinsic, it's part of all of us, aspect of humanitarian, through which people seek ultimate meaning, purpose, transcendent, experience a relationship to self, family, others, community, society, nature, and for some, the significant or sacred. Spirituality is expressed through beliefs, values, traditions, practices. So when I'm looking at screening and assessing and understanding another spiritual beliefs, I'm always looking at meaning, purpose, and connectedness. How does this person stay connected with those around them, the world, the universe, God, if they're a believer? Spiritual distress, and that's what we're looking for in palliative care. You physicians and doctors, you're looking for, the physical pain. The psychiatrists, the psychologists, you're looking for emotional pain. But we also have to understand that spiritual distress, that inability to experience and integrate meaning and purpose in life by being connected with yourself, with others, art, music, literature, nature, and or a power greater than oneself. One of my favorite quotes is that suffering is not a question that demands an answer. It's not a problem that requires a solution. It's a mystery that demands a presence. We need to be present to suffering. That is not to say we don't work. I'm a deep believer in advocacy, that we don't work to advocate for the end of what's causing the trauma in Gaza. We work to make sure we can access analgesic medication, in countries where people need palliative care. We work and advocate that spiritual care is an essential component of palliative care. But when I'm with a patient right here, right now, sometimes the most valuable thing I can do is to fully, actively be present to someone who's undergoing, sometimes for me, unimaginable suffering. One definition of spiritual care that I really like comes from our colleagues, thank you, Moira, in Scotland. From the NHS, that's the care that recognizes, responds to the needs of the human spirit when faced with trauma, ill health, sadness. It can include that need for meaning and self-worth to express oneself. It can mean faith support for ritual, for sacraments, for prayer, for reading of sacred texts, or rites and sacraments. Or it can be that sensitive, active listening. It's not passive listening. It's truly being present to our patients, to our clients. Spiritual care begins when we encourage human contact in a compassionate relationship and moves in whatever direction the patient says. Because always in palliative care, this is patient-centered care. It's not about Father Rick's personal religious or spiritual beliefs. It's about your personal religious, spiritual beliefs and what you need for healing and for wholeness. Compassionate listening is listening to that inner story. It's deep listening. It's listening to what the client says, how it's said, but it's also listening to what is not being said. It's listening for spiritual things as I'm, tell me how you're doing. Tell me more. What's going on in your life? I point to IV polls. How are you dealing with all of this? And I'm listening, especially in my role as chaplain, for those spiritual things. How is meaning? Does this person have a purpose? How are they experiencing hope, connectedness, acceptance, or the lack of these? I'm listening also, not only for spiritual distress, but this is my social work background, is that we also want to look for the strengths. I want to know every person has spiritual resources and strengths, but sometimes a disaster or a trauma, and especially ongoing trauma, hides those, it puts them into the background. And our role as caregivers, as clinicians, is to listen and identify some of those, those spiritual sources, the spiritual resources of strength, and helping patients make the connection between their spirituality, their meaning and their purpose, their well-being, and their coping. These are two slides I just love, and I know my gosh, the time is flying, but we'll send these slides. This is looking at a wonderful slide for spiritual care. What am I looking at as a chaplain about those spiritual needs of connection, peace, meaning, purpose, transcendence. What are the strengths of this individual? And then where is the distress? So that ultimately I want to put spiritual needs into the treatment plan, both in palliative care as well as trauma. Oops. The same is true for children, and our children have spiritual needs, which may be the different or the same, or usually different, in my experience, than their parents. And children have those deep spiritual needs of love, faith, hope, integrity, and beauty. They have, I look at, I cringe when I go into children's hospital and there's that sign on the door, male caregivers, please see nurse before entering the room. And I know what that means. And it breaks my heart, that this is that trauma that someone's going through. And so how do then we create healing from that? Moving a bit to disaster spiritual care is a process through which individuals, families, communities affected by a disaster, affected by trauma, draw upon their rich heritage of faith, hope, community, and meaning as a source of strength that can bolster the recovery process. So often, and I hope this is changing in the United States with VOAD is really pushing this, that spiritual care needs to be a part, integral to disaster care. I get it. If someone's bleeding, screaming in pain, that's not the time to do a spiritual assessment. I get it. But don't say that can wait days or weeks to do that either if we're going to be doing comprehensive care. Because the spiritual strength can be an essential part of that person's recovery process. We need to integrate spiritual care into disaster and trauma responses. How that person gets meaning, purpose, and connectedness, it's essential to all of us, whether you're atheist, agnostic, or a deep believer. It's part of who we are. And disasters significantly disrupt people's spiritual lives. It may be their religious beliefs and practices. It may be how they get meaning. But the World Health Assembly, that definition, I put it up here constantly. Early identification and correct assessment and treatment of pain and other problems, whether physical, psychosocial, or spiritual. It's in the definition. And if we avoid this, again, we're not doing comprehensive palliative care. And more importantly, we may be ignoring a deep source of pain and suffering that we could alleviate with a client that we're treating. Disaster spiritual care is unique. The disaster spiritual care provider engages in concentrated spiritual care during there's waves of this critical stress that are often frequent and intense. Why did God allow this to happen? Screaming at me. Where is God in all of this? As people, as spiritual care providers worked at the Twin Towers after 9/11. It's of duration, and it's different than the spiritual care that's kind of normal in my day-to-day rounding in the hospital or in the setting in a mosque, a church, or a temple. It's the severity of the disaster that requires well-trained and credentialed disaster spiritual care providers. The goals of disaster spiritual care is much like what Yasser talked about, what all of you, the physicians and nurses, talk about. We want to stabilize after the initial impact of the disaster. We want to reduce symptoms. We want to promote resilience and coping. And hopefully we want to return to an adaptive functioning, or it may be referral. for, as Dr. Yasser said, to therapy or ongoing spiritual care. Dr. Yasser also mentioned psychological first aid, and and again, he talked about this. I don't want to repeat it, but I want. Pardon me? Okay, so that we have to listen, but don't pressure people to talk. This is so key that we don't re-traumatize people. We have to take care of ourselves. That expectation that we as care providers can be immersed in suffering and loss and not be touched by it is as unrealistic as walking through water and not getting wet. If you're involved with this, you need to have a spiritual self-care plan. That may be your own religious rituals, meditation, how you create meaning, purpose, and connectedness. Self-care is in all of our religious traditions, and we need, if you are religious, to adapt to those. And finally, write it out. For me, if it's my self-care plan isn't concrete, isn't in my diary, it doesn't happen. And with that, I will turn over